everyone, Anna here with the Coding Guild. We meet today to review the latest information and updates about the CDEI free AAPC course. What is there to know? First of all, is the course really free? Well, the short answer is yes, it is really free, but please keep in mind that you have to sign up by the end of the month, so the 30th of September. You have to be a US-based coder, and you also have to be currently credentialed. If you are an apprentice, that's fine, so CPCAs, COCAs, and so on also qualify. What code books do you need during this course? You will need everything inpatient related, and that is ICD-10-CM and ICD-10-PCS. According to the course description, this course material is building on current year guidelines, so 2021. You don't necessarily have to get the 2021 books, as we are so close to changing our code set, just some days away, right? But if you do decide not to get the 2021 version, just remember that some of your answers will not line up with the course's answers. But, that's what we have the study group for. On the promo page, AAPC states that the textbooks are on them. Does it mean that you don't have to purchase books, that everything will be included? Well, unfortunately, no. What they are referring to here is an ebook, a textbook. You know how all AAPC courses have those downloadable PDFs for reading material? Well, great, because this one doesn't have it. This course will come with an ebook through VitalSource Bookshelf. This is an ebook reading service. After signing up for the course, approximately in 24 hours or so, AAPC will send you an access link. You have to register a new account with Bookshelf if you don't yet have one, and then you can access the CDEI study guide. Currently, this is the course material that we have as textbook. How long is the CDEI course? We can answer it in two different ways. The first answer is that altogether we have 4 months to finish this course from the date of purchase, so that will make it October, November, December, January. We have to finish by the end of January. This will include the 3 months originally coming with the course plus 1 month's grace period, but after this, extensions must be purchased if you want to retain course access. And the other way to answer this question is that at least 20 hours should be dedicated for the course material. As of right now, testing for the CDEI is also free. The only catch is that only those will be allowed to test who can prove at least 2 years of relevant work experience. You will see on the sign-up sheet that AAPC asks for your resume, so unfortunately, as of right now, only people with experience will be allowed to go for it. This is still a beta exam. For more detailed information on what we know so far about the CDEI beta exam, please see my full-length video up in the corner and also in the description below. Beta exam? What is a beta exam? Worry not, beta exams are totally normal. They are the last step in exam development. They are kind of like experiments or trials to find the best possible questions for any given credential. AHIMA does this every year, by the way, so the first some months of the year, the candidates will take the beta exam to help AHIMA figure out which questions are too hard or too vague, or which ones don't represent the credential well enough. And after those some months of beta testing, they finalize what questions they actually want to test people on. But it doesn't mean that this exam doesn't matter. If you pass the beta exam, either with AHIMA or AAPC, you passed the exam and you will get the credential. The only difference between a beta exam and a normal exam is that during the beta exam, you are helping the organization figure out what they want to do in the future, really. So, do you need 2 years experience for this course? Maybe, but don't let that scare you. Unofficially, there is no requirement for anybody to have 2 years experience before taking this course, nor is it enforced, only for the exam. Unofficially, I would say that this credential, the CDEI, is probably best for those who have at least some kind of fleeting familiarity with inpatient guidelines, coding, and notes, even if only from another inpatient course or from the clinical side. Yes, it is true that CDI professionals are not coders. They are often nurses or health information management professionals who know what the documentation needs in order to support charges, medical necessity, and the diagnosis codes submitted. And to be honest, in order to substantiate all the charges and medical necessity and codes, one must be familiar with disease etiology, reimbursement methods, and just how the whole inpatient infrastructure works around a patient. So in short, this course is not an inpatient coding course. It will mention PCS coding, diagnosis coding for the inpatient setting. It will review the guidelines. It will review reimbursement methodologies and so on. But it is not a full-blown inpatient course. If you remember, inpatient courses are their own thing with several chapters and modules and practice applications and whatnot. It is easier to have that knowledge already when coming into the CDEI course, but if you are not afraid of putting in the work, it is absolutely doable without the experience as well. Just don't get overwhelmed. It can be a bit scary, especially with PCS. Just be ready for everything if you don't have experience yet. It is doable. Will this credential get you a job immediately? On its own, probably it will not get you a job quite yet because it's a brand new credential and employers usually need a little bit of time to catch up with the times before they start requesting it. Also, be mindful of the fact that this is an entry-level CDI credential. There are more advanced ones out there from AHIMA and ACDIS. If I were you, I would sign up for this course for the CEUs and for the knowledge, but then take the more advanced exams to prove my expertise and become more marketable. If you like it so far and you are serious about this and you want to do this, there are a lot of other additional resources for you. I will link them in the description below. But if you changed your mind, worry not, there is still a way out. Before you leave, please still consider that knowledge is knowledge. Whatever we get for free is amazing, and this is a full study guide with a lot of information, so I would say you cannot really go wrong. And also it comes with 20 CEUs. That's amazing. If you go for the other offerings with the specialty exams, first of all you have to pay for the exam, and second, that one only gives you 4 CEUs. Of course, the choice is yours, but I would say the return on investment free for 20 CEUs is pretty amazing. So stay with us, do the CDEI. But if I couldn't convince you and you still want to leave, then please reach out to info@aapc.com ASAP, and they will be able to undo your registration for the course. And that's all I had for today. This was just a quick update. Thank you for being here with me. More coding help at thecodingyale.com. See you soon in our next video.